got to chatting, and she told me about your wonderful One Lamb initiative here, and asked me if I would come and speak, and of course I'm thrilled to be able to do so. I did work with Rosalynn Carter for 20 years, and everything that I thought that I knew about caregiving, I will just say this because I know a lot of you are caregivers. Once I was thrust into the role of caregiver, it all went out the window. So if that's ever happened to you or you felt that way, I hope I'm going to be giving you some things that will make your journey an easier one for you. This is one of the last photos that I had with Rosalynn. This was actually after I had retired, and she was starting to get very frail. But I have to tell you, she was such an humble person. And what I love about the programs you're offering here is that you're helping to take away the stigma of mental health issues. I don't think there's a family on earth that hasn't been touched by mental health issues, and she was such a strong supporter for so long. So putting it out in the open, bringing people in to talk to the congregation and to the community to talk about mental health is just, that's what has to happen. She would be so proud of what you're doing here. I just have to tell you that. I think there's a reason why C reached out to me, a total stranger, and I'm here, so thank you again. Probably a lot of you have seen this quote. Rosalynn said it all the time, and it's so true. There's only 4 kinds of people in the world: those who have been caregivers, those who are caregivers, those who will be caregivers, and those who will need caregivers. That means just what it says. Every single person in this room, if you haven't been touched by it yet, you're going to be touched by caregiving. And that's why it's so important that we talk about the mental health needs of caregivers, because it's not an easy thing to do. I hate what I call death by PowerPoint, which means a slide with a whole bunch of text on it, but I'm going to do it to you anyway, just for the first few slides, and there's a purpose to it. I want you to understand just how serious this is, so that you understand the need for caregivers to take care of themselves. And Family Caregiver Alliance out on the West Coast has been doing a lot of research for a long time. Rosa Carter Institute has worked with them for decades, and this is the newest research. So some of this may startle you, and I'm not trying to scare you, but I think that we need to understand what's really going on if you're in the caregiving role. So first of all, an estimated 44 million Americans are caregivers. The value of this unpaid labor force is estimated to be at least $306 billion a year. Caregivers are the backbone of the long-term care system in our country, and that's the truth of it. If all the people that are doing it because of love and devotion and care threw up their hands tomorrow and stopped doing it, guess what? There's not enough people to step in and do it. So that's why it's so important that we take care of caregivers and that caregivers take care of themselves. A lot of caregivers are ill-prepared for their role, and they don't have much support. They aren't told the things that they need to know. They may find it out down the road. I've already heard one person this morning say, I wish that I had known about this years ago. And so I want you to be aware there are a lot of things out there. I'll talk a little bit more about that. But caregivers are at risk of negative outcomes, emotional, mental, and physical. And caregivers are oftentimes more likely to lack their own health insurance because they've had to stop their career and bow out early to take care of somebody. That affects their Social Security, affects their ability to have their own health care. Caregivers show very high levels of depression, and these statistics are a little frightening to me. Higher levels of depressive symptoms and mental health problems just because they're in the role of being a caregiver. 40 to 70% of caregivers have clinically significant symptoms of depression, and up to half of those meet the diagnostic criteria for major depression. So you're looking at a huge segment of our population that's providing care, and they are suffering, and they're suffering in silence. This makes perfect sense that as care receivers Functional status declines, such as with Alzheimer's disease, and they're unable to do more things for themselves. The depression and burden on the caregiver goes up, and it goes up significantly. 30 to 40% of dementia caregivers suffer from depression and severe emotional stress. And this one may surprise you. Mental health conditions for the caregiver continue or worsen after a placement of their patient in a nursing home. And there's a lot of reasons behind that. Just because the person is not in the home and they aren't doing that day-to-day care does not mean that they aren't still suffering from depression and having a lot of mental health needs. So it's not a miracle cure by a long shot. Depressed caregivers are more likely to have other anxiety disorders, substance abuse or substance dependence, and chronic disease. And it's all because they're focused on the care of their loved one. They're not focused on care for themselves. High levels of stress and frustration. A lot of caregivers feel frustrated, drained, guilty, angry, or helpless. These are very common emotions. Some of you may have felt this if you're in a caregiving role, and it doesn't mean anything is wrong with you or that you're a bad person. These are normal emotions to have when you see a person that you love start declining and you aren't able to do anything to stop that decline. Caregivers also have a loss of self-identity, loss of self-esteem. I think this is the big one: constant worry and feelings of uncertainty. Less self-acceptance and feel less effective and less in control of their lives than people who are not caregivers. More than 1/5 of all caregivers are exhausted when they go to bed at night, and many feel they cannot handle their responsibilities. Caregivers who experience chronic stress may be at greater risk of cognitive decline themselves, including loss in short-term memory, attention, and verbal IQ. There are some consequences specific to women caregivers. Female caregivers, who are 2/3 of all unpaid caregivers, fare worse than their male counterparts. They have more depression, more anxiety, lower levels of well-being, life satisfaction, and physical health. There's a dramatic increase in risk of mental health consequences among women who provide 36 or more hours a week of care to their spouse. And I said this already, but many caregivers put off doing what they need to do for themselves because they're so focused on the care of the other person. And why? And this is the reality. Most of us would rather give than receive. Am I right? We just seem to be programmed that way. It makes us, it increases our self-esteem and maintains our sense of control when we're the one giving. And we say things like this: I want to give back. God has put this in my life. I honor my vows. These are things we say when we are not wanting to take help and receive. And this is what you need to know. That is danger. That is a sign of danger, because nobody can do it on their own. Not a single person on earth can do it alone. So you've got to have help. So what do you think is the #1 skill that caregivers need to maintain the quality of life for themselves and the person they're caring for? The #1 skill. And that's what I'm going to spend the rest of my time talking about. And maybe this will give you a clue. Can anybody tell me what that means? Resilience. So resilience is what I'm going to be talking about. And you don't have to be a caregiver for you to get something out of this information, because resilience is not something that you're born with or not born with. Resilience is something that can be learned. And I know that you probably all have somebody that you've seen in your family or a friend that seems to be able to roll with the punches and take bad things happening and recover quickly from that. And then there are people who just go down in a hole and seal themselves off, self-isolate, and don't show resilience. But it is something that you can learn. So I'm going to talk a little bit. I'm going to put all 4 of these up. These are the main factors in resilience. Being able to make realistic plans and take steps to carry them out. A positive view of yourself and confidence in your strengths and abilities, skills in communication and problem solving, and the capacity to manage strong feelings and impulses. There is nothing wrong with those strong feelings I mentioned before. We don't like to say words like anger, resentment, bitterness out loud. But if you don't deal with those feelings and get them out in some form or fashion, they're going to come back to get you, and it may not be pretty when that happens. So it's okay to have these feelings, but then you need to move off of that. Allow yourself to have the feelings. Don't feel guilty that you're having those feelings. Everybody has them. And then move forward. So I'm going to give you 10 strategies for building resilience, and know that this is a personal journey. No two people are alike. And so whatever you choose to do out of any of this, tailor it to your own beliefs and culture. These are just, hopefully tools for your toolbox and things that you may remember when you start getting into maybe crisis. Obviously connect. Connect is number one. You've got to build good relationships. I can already see evidence that you have a lot of really strong relationships here in this church. You have a lot of supports. Not everybody has that. Accept help and support. I'm going to talk for a minute about this because I think too often we think that we can do it all, or I've heard this in all the years, 20 years of doing caregiving work with the Rosalynn Institute. Nobody can do it as good as I can. Has anybody ever thought that or heard somebody say that? They're offering to help, but they are not going to be able to. But again, you've got to have help. You've got to, or you're going to suffer. Your mental health is going to suffer. And like I said, I hope that I wasn't scaring you with those statistics, but that's how critical it is that you take care of yourself. So I have a friend, Dr. Barry Jacobs, very well known in the caregiving field, and he talks about receiving with grace. And that's something that we need to think about. When people are offering to help you and you don't allow them to, then you're robbing them of something they may need to be doing. So think of it that way. Receive help with grace. Don't keep shoving people away and saying, no, I'm fine, I don't need anything. If nothing else, think about, if I let them do this for me, maybe that's something that would make them feel better about themselves. So turn it around like that and think about how you're depriving somebody else of the joy it gives them to be in the helping end of things, okay? Utilize your faith community, any local groups that provide social support. Obviously you do that gangbusters here, and I'm really glad that you have everything that you have here. I'm sure that you know people that don't go to this church and may not have the supports and things. So when I said that, receiving with grace, you also, if you are in a caregiving journey, you're learning important things that you can impart to other people as you see them start to go through their journey. So you can give to others too, and you'll see how good it feels to be able to help someone else out that's going through caregiving. And this, I said this already, remember that assisting others in their time of need also benefits the helper. So just please hold on to that. If you don't remember anything else I say, receive with grace. It's important for you to do that. Avoid seeing crises as insurmountable problems. When you're in the thick of caregiving and might have a whole lot of things that are going south all at the same time, it's easy to get in that crisis mode and you think something is something you'll never be able to climb up out of. But that isn't true. You can just realize stressful things happen to everybody. It's not just you. And it's any problem is something that you can do problem-solving skills and try to find a solution to. But you've got to not see it as a huge crisis. I guess what I'm saying is don't over-catastrophize things that are already bad. So you can change how you interpret and react to things. Maybe some of you have a friend, like do, that everything is a crisis, and it's really not big things that she thinks are a crisis. But even if something is a crisis, instead of getting just, oh, I can't do this, this is a crisis, take a deep breath, realize these things happen to everybody, and change how you react. I think one of the major things that happens in caregiving is people become reactive. They're waiting for the next shoe to drop, and so they're always in that crisis mode and they're reactionary. Reactionary mode is not a good mode to be in, and we don't do our best thinking when we're in a reactionary mode. So what I'm saying is try to be proactive and think things through and not be reacting all the time. It's an easy thing to fall into, but it's really not good. It's not good at all. Look beyond the present. Whatever may be going on today in your life as a caregiver, whatever may be going on with the person you're providing care to, this too shall pass in one form or another. And you just have to keep your eye on the long-term goal here. With a person, my father died of Alzheimer's disease 12 and a half years ago. My mother has Alzheimer's disease now and is in hospice care. And if you sit with that and get stuck with that, then it seems kind of catastrophic. But what can be done for mom is to make sure she's somewhere safe, where her needs are being met, and she's free of pain and free of suffering. And that is it what I wish? No, I wish that there'd be a cure tomorrow and she would come out of it. You just got to think realistically and look beyond the present and just do what you can in the given moment. Accept that change is a part of living. If someone in your family is diagnosed with anything, with any type of illness, and it could be a child diagnosed with an illness, you can become a caregiver. Mrs. Carter used to always say it's the unexpected career. Now, as you age, as my husband and I are aging, you can sort of start to see that at some point somebody's going to need a little bit of care or a helping hand down the road. But literally something could happen any day just like that, and you could be thrust into a caregiving role. So just know that change is a part of living, and this is one of my all-time favorite quotes, but don't forget the serenity prayer. If you need to make a poster out of it and put it somewhere where you're looking at it every single day, do that. Because there are things as a caregiver that you're not going to be able to change. And you've got to let go of that with grace and have wisdom to know, well, I can't do anything about this, but I can do something about that. And of course, God grants you that serenity, so ask God for that help. Move towards your goals. Sometimes as caregivers we can get not thinking forward, and I've said that already. But have some goals, have a caregiving plan, and what are our goals that would be realistic, and focus in on that. Do something regularly for yourself, even small things are accomplishments. And it doesn't matter what it is, it can be very small. Don't focus on things that seem unreachable. Ask yourself, what's the one thing I can do today? I'm a person that makes a lot of to-do lists. And if I do things that weren't on the list, I go back and add them to the list just so I can cross them off. And that's sad, but I do it. He'll vouch for me on that one. But when you're in the caregiver role and you have all these things you think you need to do today, likely they're not going to all get done. Maybe just put one thing on your list and see about getting that one thing done. Because that will make you feel like you've had some type of a productivity to your day. If you keep putting out, well, I should be able to handle this. I should be able to juggle the kids, the grandkids, the this, the that, and take care of dad. If you're focusing on too many things, you're going to do none of them well. So pick one thing. If you do get that thing done, then you can pick a second thing, but don't overextend yourself. I do want to say too, in taking care of yourself, which building resilience is about taking care of yourself. Early on with Dad and my caregiving with him, which for the most part was long distance, except for when I got to go and be the one that stay with them for a few days. I love to read, and I can't read anymore. I don't have time to read. Well, do you know that if you read 10 pages a day, that's not very much, is it? You can do that probably in 10, 15 minutes. You can do it in the bathroom with the door locked if necessary, with everything else that might be going on. But if you read 10 pages a day, at the end of a year, you have read 12 entire books. 12 entire books. So look at it like that, you know, take it down to a smaller level. Don't set your expectations high, set them low, and then go from there. Does that make sense? I like this picture. People put in their heads in the sand. But take decisive actions. Too often I see caregivers get all caught up in what's going on in their life, all the problems and let's face it, drama that could be going on in your life. And so they put off making a decisive action. They may ruminate for days, weeks, months over a decision. Don't do that, because that's keeping you from moving forward. And that's what I'm talking about, is your ability to be resilient and move forward from things. So whatever action you need to take, whatever it is that you're having to make a decision about, give it a lot of thought, maybe give it a day, sleep on it overnight, and the next day, do something. Just do it so that you can move on to the next thing that's going to come into your path. If you put things off, if you don't make decisions, then nothing is going to happen. But I have seen caregivers do this over and over and over again. I won't say unwillingness, but the not allowing themselves to just make an informed decision and move on. And that could be a decision about putting someone in a nursing home. It could be any number of decisions that might need to be made in the journey of caregiving. But don't be like these people, because you're not going to get anywhere. Look for opportunities for self-discovery. Caregivers are notorious for not taking time for themselves. Maybe it was gardening that you always did before, and I can't do it. I've got to be there 24/7. I've got to look after this person. I've got to do that thing, and so you give it up. It could be that you run. It could be anything that you do, and most caregivers stop doing all of these things, and it's not good. One of the things that I didn't put it in a slide because it's kind of hard to talk about, but just by virtue of being in the caregiving role, you are at risk of mortality at a much higher level than the general population. And again, I don't say that to scare you. I say that to make you aware that a lot of times, if you're not doing these things to take care of yourself, something happens to the caregiver. I have seen a lot of caregivers die before the person they were providing care to. And not everybody has a second person that can step in and be that caregiver if something happens to them. So, just be thinking about these things. If you get into that mindset of, I can't have a sitter come in while I go and have coffee with a friend and go out to see a movie. Oh, yes, you can. And oh, yes, you should. Because you don't want to be a casualty of caregiving. You already know you're at greater risk of depression, anxiety, increased levels of stress. You don't want to also be at increased risk of dying because of what you're failing to do for yourself. Things that I have found really good, and everybody has their own thing that they're into, is yoga. I swore that I would never take up yoga, and it was mine and life-changing to do yoga. Journaling is something that I just cannot do. I don't know why, but it brings a lot of joy to a lot of people to just get their feelings out. I said earlier, having bitterness, anger, resentment, all those things sound horrible, but get them out. Write them out if that works for you. I know journaling works for a whole lot of people, just not for me. Something that I found very late in life, believe it or not, I'm a member of a West African drumming group. And so these are the kind of drums that I play with some other women about my age. And it's a great stress relief because you can bang it away on the drum. You can bang it out. So these are just some suggestions, but again, I said at the beginning, it's what works for you in your situation. Do not deprive yourself. Don't be a martyr. Please don't be a martyr. My mother did that for my father, and it destroyed her. It destroyed her. So don't do that. And now she's the one needing care. Nurture a positive view of yourself. A lot of times I've heard caregivers say things like, I'm so stupid, why did I do, beating yourself up all the time and thinking that you should have been able to handle everything. And maybe something slipped through the cracks. That happens even if you're not a caregiver, right? I mean, it can happen to anybody at any time. But develop confidence in your ability to problem solve. That helps you build resilience. And that's what it's about, building your resilience. One thing that we don't talk about in the caregiving journey is how long it can be. One of the last programs that I helped implement at the Rosalynn Carter Institute is Operation Family Caregiver. And Mrs. Carter felt very, very strongly about 15 years ago when we had our big board meeting at the Carter Center here in Atlanta. We were trying to decide what was going to be the next population of caregivers that we looked at and tried to support. And she said, I want to know what we're going to do about the people who are caring for our soldiers who are coming back from Iraq and Iran. The ones who may be missing limbs, the ones who have traumatic brain injury, PTSD. What are we doing for them? Well, now this is a new group of caregivers, relatively speaking. It really isn't, because there have been people coming home from wars forever. But in the earlier wars, people died on the battlefield. A lot of the injuries that I've seen of young folks are things that they wouldn't have made it. But with the advances in medicine and technology, and most of the caregivers and military caregivers are spouses, and they have kids at home, and they have careers, and now they are ecstatic their husband is home, but he's not him anymore. And he doesn't contribute the way he used to. A lot of these younger caregivers are having to quit their jobs in their 30s. And that severely impacts, Social Security and all of that later on. But they can't leave them home alone for a lot of different reasons. So, I said earlier, caregiving can happen at any point in your life, but we all have this need to be resilient at whatever age we get put into the caregiving role. So believe that you can, and then do it. And this is a hard one, but put on your pretend Superman or Superwoman cape when you get up in the morning and look in the mirror and say, you know what? I am strong. I can do this. And believe it. Believe it, because you are strong. There's nobody that's been put into a caregiving situation that doesn't have strength at their core. Again, it's not the easiest thing in the world to do. So think positively about yourself. Keep things in perspective. Faith gives you an inner strength and a sense of balance and perspective in life. The actor Gregory Peck said this. But I think that we all, and of course you've got a faith community here, you understand about putting things in perspective. You understand about the need to let go of the burden sometime and pass it off, pass it up. And to maintain some perspective to your life. Don't give up hope, and remember every day that I am worthy and I deserve some time from me. Okay? Maintain a hopeful outlook. This is one that can be very hard to do when you're in the caregiver role. This, of course, is the infamous or famous glass half full or glass half empty. It's all on how you look at it. I challenge you to always see the glass as half full. Even when you feel depleted, even when you feel like there's not a single positive thing that you can possibly tap into, see that glass as half full. Visualize what you want instead of what you fear. My mother used to say when we were growing up, that if you're always looking at something in a negative point, in a negative way, it's going to be negative, right? And it's really true. We can do marvelous things with our brain. And so have that sense of hope, no matter how dire a situation may be, have that sense of hope and let that be what's keeping you going. Don't cave into the fear. That's actually the easy thing to do. It's harder to have hope. So challenge yourself. I can have hope. I can have hope in this situation. I can have hope to get through another day. So taking care of yourself looks any number of ways, but I want you to know you are enough. You matter. You are unique. You are loved. You are worthy. You are beautiful. You are divine. And so I want you to sit with that just for a minute. I want you to, if you need to, look at the words and close your eyes for just a few seconds and take that in and believe it. How does that feel? Did you believe it? Is this something you could take a few seconds out of your day, as many times a day as you need to, and just get in that zone? Remember these words, sit with it, believe it. Because it's true. Places to look for help. There are so many things that I could tell you about. I actually have been thinking this weekend as we've been up here in Atlanta. Resources change all the time. What I'd like to do is go back home, put together a comprehensive list of resources and send it out to you guys. But because there's so much stuff out there. Some of it's really good, some of it's not so good. So I'd like to do that for you. But I will tell you about a couple of things. Self-help and support groups, of course, you have these things available just through your own church here, and I think that's powerful. Make sure that other people you know who are struggling and need help know about the things that have helped you. We talked about that. The title of my talk, Caring for You, Mind, Body, and Soul. When I first came to the Rosalynn Carter Institute in 1998, our pivotal first program that we did to support caregivers is called Caring for You, Caring for Me. And the second edition of that I was blessed to be the co-author of. And that program has gone all over the country, all over the world. We actually went to Seoul, South Korea, and trained social workers in Korea in the program. And they are implementing it there and teaching it in the university there. We also have a caregiving degree program at Georgia Southwestern State University in Americas, which is where the Rosalynn Carter Institute for Caregiving is, where Rosalynn graduated college and President Carter also attended before he went to the Naval Academy. So caring for you, caring for me. So caring for me allows me to care for you, right? Something that we did, I was lucky to be able to work on about 2 years ago. One of the places that we work with is Riverside Health in Williamsburg, Virginia. I've had grant sites all over the country, and that's been one for a long time that I help support and help them get their programs up and running. And what they found is caregivers have a hard time getting away to go to support groups sometimes, and of course we've always known that. And sometimes caregivers don't want to leave the person they're caring for, or any number of situations. So what we did is we took Caring for You, Caring for Me, and using all the new research and science behind microlearning, we made it into microlearning. And so 7-8 minutes, little bites of information. I'll send the link because it's all free to use and it's on YouTube now. but we were able to, I do think there's a lot to be said for being in a room with other people who are going through similar things as you. But if you can't do that, do something. And so Caring for You, Mind, Body, and Soul is the name of the micro-learning program that came out of the first program. So I definitely want to recommend that to you. Books and other publications, I will also put this on my list that I come up with for you. Again, every day there's a new book or something coming out that will help you in your caregiving journey. While no two journeys are alike, caregivers go through a lot of the same emotions and challenges. So you can learn from others and just avail yourself of anything and everything you can. Online resources, I was just talking about, that program started off being something that only people who were patients of Riverside Health could access. And now it's on a YouTube channel and everybody can access it. So a lot of things are moving to that. It does no good to have supports for caregivers if they don't know about them and don't know how to access them. So everything really is at your fingertips these days. And you don't have to leave your home, and you may not be able to. I do need to end with this. There are situations that, for a certain amount of us, and you saw the statistics at the beginning of this talk, that you're going to need something more. You may need a mental health professional, you may need pastoral counseling, but don't think that that's a luxury you don't have time for. If you don't take care of your mental health, the healthiest way to care for another is to care for yourself first, not last, first. It's not selfishness, it's what has to be. So please remember that. Everything in this talk came from mostly these resources, the American Psychological Association, and they have tools for caregivers. Family Caregiver Alliance is where I got all the statistics from. Rose and Carter Institute for Caregivers is still actively involved in doing a lot of work. They're really focusing these days on advocacy for caregivers because people don't even like to say they're a caregiver. I'm just being a good wife. I'm just being a good parent. I'm just being a good whatever. I'm not a caregiver. So they don't look at resources for caregivers because they don't see themselves as one. But you know when you are one, so you can avail yourself of those resources. AARP has an entire segment of their website that's just for caregivers, and they have wonderful resources and tools on there. So look at aarp.org as well. Again, I'll be happy to put together a comprehensive list for you. And I thank you for your time. If anybody has any questions or anything you want to ask me, I'm happy to stick around and answer that for you. I know that this was a lot of material in a very brief time. My entire presentation I will make available for anybody that wants to have access to it. But just the key things that I talked about. The healthiest way to care for another is to care for yourself first. Take the time that you need to nourish yourself, spiritually, physically, emotionally, wherever you need it. Please do that. And again, Mrs. Carter would just be so pleased. I wish every church and every community around the country, around the world, had supports like you do here, because a lot of communities don't. So I also challenge you to reach out to your friends you know that could use these resources and pass them on. Thank you very much.
Thank you so much. That was so helpful and so meaningful. One other thing as far as support that I immediately think of is something that I myself just learned about 2 weeks ago. This church does have a support group for caregivers. It's on Friday morning, and it's the first and third, I know for sure.
And fifth, if there is one.
In the fifth, okay, thank you. And it is a wonderful, I have been to that myself and have received a lot of information there also that, but thank you so much for, do any of you have any questions? Does anybody have a question?
Yes.
It's I'm sure there's no easy answer, so feel free to say something in general, but I'm on the other end of the spectrum, that, give me advice for when the person does not want caregiving, that is stubborn and, sort of wants to do it all themselves, and as a spouse, you sort of are trying to offer new ideas, and they get very defensive.
Right. I think,
I mean, this happened to somebody I know.
okay. Your friend wanted to know. This is a very common thing to happen. You have to realize when a person gets a diagnosis of whatever it is, they're losing a part of their abilities and a part of themselves. And so it's important to remember autonomy. Let a person do as much as they can for themselves as long as they can possibly do it. One thing that my mother did with my father, and it was very hurtful, is she took opportunities for engagement away from him way before she needed to think about doing that, because she was embarrassed about what he might say or do in front of other people. It can be really hard, especially if it's a person that has dementia and they don't understand the things that are going on. But let your person do what they can do for themselves as long as they can do it. If it takes 5-10 times longer to get them up and bathed and dressed and out the door to an appointment, then just plan for that. Don't insist on doing it all for them, because they're grieving too. You grieve as a caregiver at the losses, but the person that's having the losses is grieving the losses as well. So I guess I would say, let the person do what they can do, and if it becomes that it's something they just can't do, then just, and if they aren't responding to you or whoever it is that's talking to them, sometimes a doctor can be very helpful with this. If you go and talk to the doctor ahead of time, and we all look up to doctors, and the next time this person goes to the doctor prescribes some things to them or for them, not in medication, just, what about you should do this, or maybe it would be helpful if you do that. They listen to doctors, and they may not listen to you. Actually, I think in a lot of times in families, you're the last person they're going to listen to. So it's very common. I don't know if that's helpful at all, but getting somebody else to give that same information to them instead of you giving it to them can sometimes ease it a little bit. Any other questions? Yes?
Where do family members go to get training to be caregivers? Because a lot of times they're thrown into that role.
Right.
Maybe they don't want to be there because financially that's the only option. They want to do a good job, but they're not prepared.
Right.
So where do people
And
go?
so there's, like I said, there's a lot of resources out there for that. For going and there's not like a specific training for caregivers, but for instance, the Caring for Me program, that's a 5-week program, 2 hours a day or 2 hours a night, once a week for 5 weeks. I can get you those materials if your church would ever want to do that Caring for Me program. And it really helps caregivers, and it's not just for family caregivers, it's for people that get paid to be a caregiver. You could be a social worker, a nurse, whatever. They have needs too. They're dealing with a lot of stresses too. And it can help bridge the gap between the outside people who are providing care and the family members, who sometimes are at odds, and sometimes that can be very destructive to the person that needs the care. So I'll make sure that anything that I am aware of, I'll put on that list of resources. The programs that the Rosalynn Carter does it's community organizations that decide to keep those programs up and do them. The REACH program we've been doing for a number of years, and its resources for enhancing Alzheimer's caregiver health. And I know that in Atlanta that there are places that do that program. I don't know, I don't keep up with who's doing what at any given moment in time, but I can find out more about that. But there are programs and supports out there. I'll try to put you in touch with, I know the Atlanta Regional Commission has a really good database of all that type of information for you here in this area. So I'll plug you into some people that are.
There's also one source that I had found, her name, kind of a different name, TEEPA, TEEPA, SNOW.
snow is amazing.
And she has been very, just go online and Google her, and she has podcasts, I listen to one of her podcasts every week, and she's helped me get through some times where, I don't know, the driving, when you have to take the car away, just the various steps you go through, she has a way to, I don't know how to say it, she puts it in a very light, airy, fun way.
She does. She's a wonderful resource.
Any other questions?
Well, thanks again,
So
thank you
moved.
for being here.